Avoid unnecessary surgery. This Good Morning Washington Spotlight on Your Health is sponsored by Regenerative Orthopedics and Sports Medicine.
Well, today we are putting our health spotlight on ways to get out of pain without surgery.
We are joined today by Dr. Imran Siddiqui with Regenerative Orthopedics and Sports Medicine. Dr. Siddiqui, so good to see you.
Good to see you too. Thanks for having me.
So let's start by talking about regenerative medicine, because I'm sure there are a lot of people that don't know what it is.
Yeah, so regenerative medicine is in general using the body's own healing capacity to heal injuries or conditions that otherwise can't heal on their own.
We had a Good Morning Washington viewer that was watching one of these segments and, was scheduled to go in for hip surgery and said, well, before I go do that, I want to check this out because oftentimes you can help people avoid surgery. So talk a little bit about the ideal patient.
Yes, so the ideal patient is basically anybody in pain. We are diagnosticians first. We're all board certified or teach musculoskeletal ultrasound throughout the country. And so first and foremost, we want anybody who has any pain to come in and see us, and we can figure out what's going on. Alternatively, anyone who already has a diagnosis of arthritis, tendon injuries, ligament injuries, or nerve problems, they should come see us as well, because regenerative medicine has been shown to be very helpful in those situations.
So talk to us about some of these other treatment options that you offer.
So there are multiple different treatment options that we offer that are under the regenerative category. Okay. One of the main ones we do is something called platelet-rich plasma. And that is an injection of one's own platelets into an area of injury. Platelets are the cell in the body that's responsible for healing. So a lot of times injuries that don't heal, the main reason why they don't is because there's not enough blood flow there and the platelets can't naturally get there. So what we do to get around that is we draw a patient's blood, concentrate those platelets, and inject them directly under image guidance to the area of injury, and then it can heal over time. We do the same kind of process with bone marrow, which has some other healing cells. And then we also do that with adipose grafting, which can provide a scaffold to fill in larger tears or injuries.
And I know you've got so many success stories right here in the DMV because you have locations throughout the area. You work with all major insurance companies. Many people watching right now may be in pain. They can't do the things that they used to do. And I know you have a patient that was in that same situation, but you got them back to doing what they wanted to be doing.
That's right. Yeah, one of the most recent patients that has been great to work with was a man about 60 years old who had just recently retired. He worked hard to retire early so that he can hike and trek, and that's his passion. But unfortunately, he developed a meniscus tear right around the time of retirement. Ended up getting surgery for it. Unfortunately, in this case, the surgery didn't work. Actually made him worse, and then he was unable to hike at all. So he came in very upset, just looking for any grains of hope that we can give him and anything we could offer him. We ended up doing a regenerative treatment that worked very successfully, and he was within 3 months able to hike, and within 6 months he hiked the base camp of Everest.
Wow.
And so he's extremely happy, very grateful, and that was a very rewarding case to be a part of.
And he gets to enjoy his retirement now. You guys have offices all across the DMV.
That's right.
You accept all major insurances. So for our viewers that are watching right now, maybe they themselves know somebody that has surgery planned or is just in pain. How can we connect with you?
Well, first and foremost, just call and make an appointment. You can also reach us through email. As you said, we have multiple locations throughout the DMV, and hopefully one is successful to almost everybody in this area. And so anybody in pain or anybody with any orthopedic condition should come to us, because as I said, we're diagnosticians first. So we pride ourselves on getting the right diagnosis and then coming up with the right treatment plan. And that may or may not include regenerative medicine. We just want what's best for our patients. And so that's where we start.
And we know you may have some more questions after watching this segment. That's why there's a phone number on your screen right now. In fact, the entire team is standing by to answer any of those questions you may have and continue the conversation that we're having right here and get those appointments set up. Dr. Siddiqui, great to see you.
Thank you so much for having me.